All right, how's everyone doing this evening? You guys have a good summer? So when I posted this lecture up on YouTube, or actually not on YouTube, but on our Facebook page, I did a little quick survey of what people want to actually hear within this lecture. And some of the top things you guys mentioned: leaky gut, parasites, genetically modified foods in the gut relationship, IBS, and acid reflux. So I have incorporated a bunch of that within tonight's lecture. I got a great lecture tonight on gut health. I've comprised a lot of clinical cases that I've been working on within the last 2 years in this lecture as well, and also some of the newer functional medicine testing stuff that I've been going at with some of the more advanced gut issues. If you want to move a little closer, I'll talk a little louder too. As I go further in the lecture, I'm going to pull up someone to just kind of show some of the muscle testing stuff that we do as well, and kind of show you which direction that we go with patients as far as the muscle testing and how to incorporate the muscle testing and the functional medicine stuff together. I've said some bold things in some of my previous lectures, and one of the bold comments I've made is if you've got a blocked liver pathway, or if you have a compromised gut and gut issues, you'll have a hard time conquering any health issues that you're trying to conquer. 80% of your immunity is in your gut. Health begins in your gut. Following tonight's lecture, I'm going to do a Q&A like I normally do for those of you that have come out. I will not be doing a winter lecture this year. I'm going to take a break with my winter lecture. Putting on these lectures takes a lot of effort and a lot of time to put on a good lecture. But I will be around doing the mini lectures. I'll be doing corporate lunch and learns, be active on my blog, Instagram, Twitter stuff, which I'll talk about a little bit later on. We may be doing more Facebook Live stuff within the office, so we got a lot of cool new things that we're going to be doing in the new year. October is Breast Cancer Awareness Month. The current cancer statistic is 50% of this current generation will be diagnosed with some form of cancer within their lifetime. 50% of us in this room will be diagnosed with some form of cancer in their lifetime. That's through cancer.org. Prevention is absolute key. With a statistic like that, and that statistic and that number will grow over time, prevention is absolute key. I'm not going to give too many protocols away tonight, but our breast cancer prevention protocol: your cruciferous vegetables, either nitro greens, cruciferous complete, one of those two. Keep your vitamin D levels up and your iodine levels up is absolute key. We promote having thermoscans over yearly radiation of mammograms. We are completely redoing the website. We're hoping that January, February, right, Derek? The January, that whole new website is going to be launched. It's going to be a lot easier and just first class with everything. You could find us on Twitter, Instagram, Facebook, YouTube. We are everywhere. Within our page, our Diverse Health Services, Instagram, Twitter, and all that, you could find my personal Twitter page, Dr. Jeff Senechal, and also I've converted my Instagram to more of a professional Instagram page now as well. I've kind of enjoyed this actually, the Instagram stuff. I've been doing stories, weekly stories with people, showing the paleo diet, doing a ketogenic based diet, doing different themes each week, and doing a little video at the end of the week kind of going over everything. I've done some other ones with the immune system stuff, so a lot of cool things. I like incorporating that, change it up a little bit. It's been fun. If I have to see vaccine injury, you have to see vaccine injury. No one understands what vaccine injury looks like today, so I'm going to start educating everyone on my Twitter stuff. The last 2 months, once a week, I've been posting a vaccine injury case. These pediatricians want to ignore these kids and act like this stuff doesn't exist. It's everywhere and it's very prevalent. So if I have to see it, you have to see it. Hop on my Twitter feed and scroll down. You'll have some fun going through these. This is where my journey began. 20 years old, look at that punk ass. 20 years old at a hospital, 4 years as a patient transporter. This is where my journey began. You want to hear the other half of my, I've told you guys 90% of my story. If you want to hear the last 10% of the story, I just recorded a podcast last Saturday. This will hopefully be out 2 to 3 weeks. If you're on Facebook, you can look up Life Coast and it will have it posted on that. It was a fun hour. We kept going on. They enjoyed it so much they want me back to kind of go over some other things. This is our crew. This is the majority of our crew at the office. We had some new photos about 2 months ago. We work hard for you guys. We really work hard to put on a good lecture for you guys, educate you guys, and let you know what else is out there besides traditional medicine. And we like to hear your feedback. If you've had a great experience with us, leave us some reviews, let us know. We like constructive criticism. The functional medicine lab stuff's going to change as well on the new website. So, you know, I'll add in more stuff. I'm sure I'm going to do some mini recordings explaining each test on there and examples of things that why I'm running it on certain patients as well. The blog's going to be changed as well. How you guys doing?
Sorry.
Oh, you're good. So yeah, the blog's going to be changed as well. I'm a little bit quiet around on my blogs around the lecture time. I'm all game and focused when I got a lecture going on. But I'll be a little bit more active once this is over again. What's done and recorded with my Diverse Health Services DHS protocols is done. You know, it's whatever's recorded is recorded. If I'm going to do more protocols, I'm going to post some more on my Instagram stuff right now. I sound like too much of a salesman while I'm doing them. It's not a huge fan of them, but I'm going to change it up a little bit and incorporate the Instagram component to it. If you would like to Skype with us, we Skype with people all around the world. It's fun. It's absolutely fun giving health guidance to people all across the world now. This lady's from Las Vegas, diagnosed with chronic fatigue in 2008 after 5 months of having an episode with mono. Dull headache, red eyes, never wakes up rested, tried some acupuncture, didn't do too much. She already told me what's going on. Down below, she mentioned that she had some digestive issues as well. So no one knows really how to address and treat mono properly, and this goes back to you can't block your liver pathway. If you block your liver pathway and you have a virus living within your liver, you give life to this mono aspect, unblock that liver pathway, treat the mono, and this was only 2 months later. She's about 60–70% better. I was treating her with her gallbladder for the digestive issues. She was still having some problems. I ran a hair analysis with her to look at her digestive tract. You could run a hair analysis on patients and you'll see how well someone's stomach is doing because you need stomach acid to absorb minerals. So if you're lacking your hydrochloric acid, a lot of your minerals are going to go to your left. And I'll show you some examples of that tonight. But if you got sufficient stomach acid, hydrochloric acid, you're going to have minerals kind of going back and forth. So I ran a hair analysis not to look at heavy metals with her as much as I just want to kind of look at her digestive aspect with this. These are my 2 children, Ethan, Jackson. Ethan's 3.5, Jackson is 1.5. We've had a great summer. I'm a kick back, relax guy on the weekend, recharge and get ready for the week type of thing. I enjoy my backyard life with them. It's been a blast this summer. We're going to probably start recording a little bit more on the stem cell stuff. We've been getting really good results with patients with the stem cell injections. Juan's doing great with this as well. The joints, like I said, the joints seem to respond very well with patients. The back, necks, hit and miss, about 50% effective, I would say, but the joints for sure, very, very effective. My wife's into gardening. This is part of our backyard. We had a garden this year. This was my picture from my last lecture in May. This was the beginning of it. We used the PDCM liquid minerals on everything. This was our late August photo. And this is the lush garden. The minerals are so good I was able to grow a play set on the side as well. Anyone who's putting up a play set, I highly recommend you young parents to hire that out to put that up. What a tedious process to put one. That was a whole weekend project that just tied me up. Putting that thing up was unbelievable. Not that it was hard, it's just very tedious. I got to emphasize, we're eating off of dead soil today. 85% of our soil is depleted of minerals. I don't care what diets anyone's doing in this room, we're eating off of dead soil. If the minerals aren't in the soil, it's not in the food, it's not in us. So many people have dead stomachs today, they're not even picking up the minerals, and I'll explain that a little further on. You gotta love this. OxyContin billionaire granting a patent for opiate addiction treatment. So you have a medication that you get everyone addicted to, you fuel this opiate epidemic, you fuel a heroin epidemic. Now you got a treatment, but only the treatment plan that you're going to make money on. This is how our country runs. This disgusts me. We haven't talked too much about it, but we carry CBD oil in the office, and we get some pretty cool results. We're getting really good results with things. When Dr. Tent and I sat down with the CBD guys, we asked them, what are your home runs? What are you hitting out of the park with CBD oil? It said seizures, pain management, anxiety, and cancer issues. I've been pretty impressed with what I've seen with the CBD oil. Search out your alternatives because pain management is horrendous in our country. A few years back, I've talked about the mold issue. I had patients checking for mold with the Petri dishes, and this was one of my patients out in California. She actually came to the office a few weeks ago, and her mold panel came back, her blood mold panel through the roof. This is what she grew at her house.
What's the sample from?
The sample is, no, this is just air sample.
From her house?
Yes. So that is mold growing within her house. What's that? Just an hour. Yep, you could do a cheap Petri dish test, an hour, cap it, and dark area, you know, if something's there, it's going to grow. I've been very intrigued about this mold. After tonight's lecture, this book is going to be my absolute focus, Mold Warriors. My next lecture is going to be a mold lecture in May. And here's a case, one of the cases that I've been working with. This was a 47-year-old lady, chronic Epstein-Barr. She did 2 years of an antibiotic, poured it in her chest, dealing with chronic Epstein-Barr on top of the Lyme stuff, still feeling like crap. She's like, I give up, I'm done. Done with the antibiotics, take the port out, done with any treatment. I don't give up. Functional medicine people don't give up, we just dig deeper. This was her panel. $60 at the office you could run this. $60 mold panel you could run. I got so many cases already built up for this May lecture and cool stories. This is unbelievable how much this is going missed. That's her mold panel. Her house was the source. This is an 18-year-old lady, girl from South Lyme. Asthmatic issues, using inhalers, still can't breathe. I still can't breathe. Inhalers are no help for me. Just feel like something sitting on my chest. This is her panel. And we're addressing her mold, and now things are starting to finally be able to change for her. What's that? Blood, yes. Yes, ma'am, that is blood. All disease begins in the gut. Your stomach is your #1 line of defense for your GI tract. 80% of your immunity is through your gut. All disease begins in the gut. Do you think Hippocrates was ahead of his time? I would say so. So tonight's lecture, we're just going to tour through the GI tract, and all the way through the stomach, the gallbladder, pancreas, small intestine, large intestine, and it's just going to be a great little tour. But all of the health starts at your stomach. Common signs and symptoms of low stomach acid. I got to emphasize this, low stomach acid, of not having enough good stomach acid. Bloating, indigestion, gas, belching, feeling of excessive fullness after meals, heartburn, mineral deficiencies, dysbiosis, yeast imbalance, irregular bowels, diarrhea, constipation, undigested foods coming out, recurring intestinal infections, food allergies, intolerances and sensitivities, bad breath, weak or cracked nails. If you've been a patient of mine at the office, you've probably heard this talk a million times. But I've got to emphasize this before we go any further. This is your stomach. Here's your liver, here's your gallbladder, here's the pancreas. You need zinc, you need thiamine, which is vitamin B1, you need chlorine from salt to produce stomach acid, hydrochloric acid. You have all your cells around your stomach that produce hydrochloric acid to keep your stomach very acidic. 2.0. If your stomach is not acidic enough, carbohydrates will ferment, proteins you putrefy, those rotting foods will go north, give you acid reflux, or go south, gas, bloating, indigestion, constipation issues. Your stomach is your #1 line of defense. 80% of your immunity is through your gut. You kill off opportunistic infections here, Candida, parasites, fungus, yeast, mold, H. pylori, and things here before they go south and create problems down below. You need that stomach acid to help you absorb minerals, absorb B12, break down your proteins, and like we're saying, your immunity for your gut. So if they're giving you medications to shut off your stomach acid for heartburn, acid reflux, turn off all these cells, neutralize all acids, you're starving yourself of minerals. You're starving yourself of B12, you're not breaking down your proteins, and you turn off your immune system in your gut. You need acid to digest your foods, and as we age, it's an alkalizing process of decreased stomach acid. We need more acid as we get older. So the common sense question to you guys is, do you think drinking alkaline water all day long helps this or hurts this?
Hurts.
Exactly. Anyone trying to sell you alkaline water, this Dr. Tent and I don't want to talk about alkaline water because you guys are killing your stomach. If you don't understand what I just explained, we can't go any further in this lecture. This is what it looks like when someone comes to the office, wants a back x-ray, and yet they have a dead stomach. All those foods going south, gas, bloating, indigestion, rotting foods, creates these black areas of gas all in the intestine. That's what someone with a dead stomach looks like on an x-ray. There are 3 main reasons patients have dead stomachs today. One of them is medication-induced. Second one's nutritional deficiencies. The third one is nervous system imbalance issues. Well, we just talked about the first one. All your antacids, Nexium, Prilosec, Tums, Tagamet, Protonix, all these medications shut off your stomach. My drug-induced nutritional deficiency lecture, this is where you could find this slide from. These are just the other deficiencies it'll create, but your minerals, your B12 are your key things that you're going to miss from this. It's your #1 reason these stomachs are dead today. Every stomach ache that goes to your MD, they want to put them on those medications without thinking twice. If someone's got acid reflux, I want to use apple cider vinegar. Let's see what the apple cider vinegar does. If the apple cider vinegar helps your acid reflux, it's telling you you need more acid to help you digest your foods. If it makes it worse, or your reflux gets worse with the apple cider vinegar, then an ulcer or gastritis may be a problem. So using apple cider vinegar helps us gauge your stomach and which direction we may need to go. Simple test. This is me scoping your stomach using apple cider vinegar. Some of you people have a hiatal hernia pushed up. Some of the stomachs kind of push up above that diaphragm. Things get stuck there. And this can create reflux issues on some patients as well. So pushing that stomach down, and I'm going to do in one of the next videos I'm going to show you guys how we do this in the office. This is just a picture of it, but we'll eventually do a demo video with this as well. This works great. I do this on infants. They want to put infants on Zantac in the first month of life with reflux issues, and it's a hiatal hernia problem. Go to the number 2 reason these stomachs are dead today: nutritional deficiencies. Zinc deficiencies. This is what a zinc deficiency looks like. These kids with white dots on their nails. Zinc, going back to the board, is needed with the thiamine and the chlorine to help produce stomach acid. And the number 1 deficiency among everyone: B vitamins. Thiamine, vitamin B1, is a specific one that's needed to produce stomach acid. Some people have such a severe B vitamin deficiency, they've got a geographic tongue. This patient was in about a month ago. It was just interesting seeing her tongue like this, and it's a bit of a B vitamin deficiency on most patients at iFix. My lecture a few months back, Fixing America's Top Nutrient Deficiencies, you could find a good bit of that info on as well. Number 3 reason people have dead stomachs is a nervous system imbalance. If someone's pointing a gun at you, you're under the gun, and you're stressed out, and you're in that sympathetic dominant mode, it kills everything. So you can see your sympathetic dominant symptoms on the left, how it affects your eyes, your mouth, your skin, your palms, your lungs, heart, blood. Digestion is either inhibited or stimulated if you're under the gun. Put a little bit more emphasis on this. You got your nerves from your spinal system that innervate all these organs. If the sympathetic dominant system's under the gun, you're stressed out all the time, your stomach's going to be completely toast all the time. Go to the intestines and stomach. Inhibited stomach, pancreas, and intestines. Everything's shut down under the sympathetic dominant mode. Some people, and some of my most challenging stomachs that I'm trying to fix, are stuck, and I can't fix them because they're stressed out like crazy and it's affecting their gut. This is a hair analysis that shows what a dead stomach looks like. Everything's going to the left. This person's not absorbing their minerals, period. So stress, your antacids, malabsorption, nutritional deficiencies that help you produce stomach acid, not having enough good stomach acid, that's what a hair analysis is going to look like. And this is why I will even run a hair analysis just to kind of gauge someone's digestive tract. Now, food allergies. By definition of a food allergen is an undigested protein, and you need acid to digest your proteins. If you don't have enough good stomach acid, you may have multiple food sensitivities, and this is what a common sensitive 7 panel that I run will look like. This is a 53-year-old lady struggling with weight loss issues. You know, when I'm looking at weight stuff, I'm going to look at the thyroid, I'm going to look at cortisol, I'm going to look at food sensitivities. Her cortisol is elevated, and this isn't too bad, but her cortisol is elevated and she has multiple food sensitivities. This could kind of go back and forth. There's some people that have such high food sensitivities that it creates gut inflammation, that it increases the cortisol in the body, and vice versa. Some people are so stressed out that it shuts off their stomach acid. They have multiple food sensitivities because of that. This is kind of how you tie these two together and how they could kind of interplay with each other. So what is the most ideal diet for someone who is a sympathetic, dominant, go, go, go type of person? A plant-based diet. Too much protein, like a ketogenic diet, a paleo-based diet, may be too much for that person to digest food. Yes, I love paleo, I love keto, it works best for me. I recommend all kinds of diets. I was going to get a little bit more aggressive in certain diets I was going to talk about tonight. But in a sympathetic dominant case, a plant-based diet works better for these types of patients. And I've had patients trying to go in the opposite direction and looking at their hair analysis, looking at all their things telling me that they've got a dead stomach, and did a complete 180 with their health and lighten up their load by pushing them more in a plant-based direction. Now, going back to Breast Cancer Health Awareness Month, Dr. Gonzalez, in his book, One Man Alone, all his work was based off of Dr. William Donald Kelly. Most of his patients who had breast cancer were sympathetic dominant go patients. He put them on a plant-based diet and used heavy doses of pancreatic enzymes, and he got good results with a lot of patients. He understood this sympathetic dominant, parasympathetic dominant system balance, and in his book, One Man Alone, if you want to know what direction to go, there was, when I bought the book, it had a questionnaire that you went through, and it was his questionnaire that was what guided him towards what direction that he went with his patients. If you got a weaker stomach, and I have a slight weaker stomach based on my hair analysis, some people could get away with food combining. It says eating your proteins with non-starchy vegetables. These things digest perfectly good. Proteins in your starchy components do not digest as well. It shuts off the stomach acid, so having a steak and eating a potato blocks your stomach acid of breaking down those proteins. My other tricky stomachs lately, the H. pylori bacteria has been pretty challenging for some patients as well. This is a type of bacteria that causes infection in the stomach. The main cause of peptic ulcers, and it can also cause gastritis and stomach cancer in some people. About 30–40% of the people in the United States get H. pylori infection. Most people get it as a child, and usually doesn't cause symptoms. But it, depending on what degree and the severity of it, it could create different problems in different individuals. So some people may get just stomach gastritis, which is inflammation of the stomach lining. Some people may get the ulcer issues, and in long-term untreated cases, it could lead to stomach cancers in others. This was a 15-year-old girl I was working with, acid reflux issues, burping a lot, gurgly stomach. She had stomach pains and problems with food and without food. Treating her and going after things, she just was hitting a wall, not getting better. I was like, something else is going on. And I had to look, and her H. pylori factor was elevated. Ideally, I start with blood when I look at H. pylori infections. The gold standard is either the breath test, or actually the stool analysis is typically the best. But I will pinpoint a lot even just through blood. But most traditional way, they want to go with the stool analysis or the breath test with them. Hers was elevated, and once we start working on that, she started turning the corner. But her food sensitivities, you could see I had to get dairy out of there. If those double digits, they got to get out there. So that was, her dairy factors were quite a bit up. Now going back to the ulcer component, looking back at the stomach, say the apple cider vinegar hurts your stomach, or you're waking up in the morning and get this dull pinpoint pain, nausea, dull nausea, things like stress. NSAID use, ibuprofen, Motrin, Advil, even Tylenol will tear up that stomach lining. H. pylori infections could irritate it. Smoking can irritate it. Excessive drinking, excessive spicy foods, all could irritate the stomach lining and push people into the ulcer issues. One of the most common things we're going to see in the office and treat on a regular basis, especially November through January in the holiday season, is your gallbladder. I love this diagram because your gallbladder is on the left, and your pancreas, or your gallbladder is on the right, pancreas is on the left. This just shows how the gallbladder, the bile duct, connects with the pancreatic duct, and all comes out. So if the gallbladder gets backed up, it could irritate the pancreas as well. Symptoms of gallbladder issues: gas, bloating, indigestion, going between loose and tight stools, burping, belching, gurgling the stomach. It's the rancid oils. A lot of your IBS, that people that get labeled in this I got IBS category, tends to be a gallbladder issue with the vast majority of them. Holidays, the rancid oils eaten out. Restaurants cut the corners. They don't change out their oils as often as they should. And those things will irritate the stomach and set those off pretty easily. You know, the pain, the gallbladder pain will be in the upper right to the center, even back to the shoulder blade. I've had people that had gallbladder shot pain up their chest, and they thought they were having a cardiac heart issue with this. This is a patient back last year in November. She had stomach pain, upper stomach pain, diarrhea, gas, dark stools, bloating, a lot of bowel movement. She actually even had blood in the stool, and it looked like she had like the beginning of a colitis attack going on. All I did was treat her gallbladder, and that was just a matter of 2 weeks, and she was 90% better. But man, the way it started off, it looked like it was going to be pretty nasty with her, and everything was a gallbladder issue. I ran food sensitivities with her just to look at every aspect of the gut as much as I can to start off with the food sensitivities. Her food sensitivities were not that bad. So going a little further down the GI tract, pancreas problems. Nausea, vomiting, pain on the upper left side tends to be your more common symptoms with your pancreas. But upper abdominal pain that worsens after eating is a common complaint with people that have pancreas issues. What's going to aggravate a pancreas patient? Alcohol, smoking, herbicides, fungicides, pesticides, NSAIDs, medications, chemicals, sugars, gallbladder issues are all things that's going to aggravate a pancreas patient. A lot of medications today, and this is just a few mentioned in this slide, but a lot of medications today I think is a big culprit that's irritating a lot of these stomachs. A lot of these foods that we're eating today that are soaked with pesticides, if you're not eating them as clean as you can, organic, you need to be aware of the Dirty Dozen list. If you live in Michigan, it's, you know, the cider mill season. A lot of these apples have pesticides and are soaked with the pesticides, and I kid you not, people hitting the cider hard over the weekend and will come in with this nausea, vomiting, pain on the left side, and it's the pancreas from just apples. I could tell, I see this during the summer when certain fruits and vegetables come in season, and people overdo it on those, and wham, it hits them hard. This was a patient, 22 years old. He was in he's in med school. I've kind of changed his line of thinking just by fixing him. He was diagnosed with pancreatitis a few years back. This all started with him on a binge drinking night because he's part of a frat. He had allergies though. In the morning before this happened, he popped a bunch of Zyrtec for his allergies and drank on top of that. That Zyrtec on top of that drinking is what pushed his pancreas over the edge, sent him to the hospital with the pancreatitis. He came in still thinking he's got residual issues from a few years back with his pancreas. Everything muscle testing wise and looking at him, and I'm like, this is a gallbladder issue. I just went after his gallbladder. I fixed all his symptoms that he thought he was having that was from his pancreas still, all just from his gallbladder issue. And that's the upper stomach stuff. I really want to show you guys some muscle testing stuff because, you know, we could run cool fancy tests. I could run the Sensitive 7. I could run some GI panels, which I'll get into further, but some of the muscle testing stuff helps us direct which direction we're going to go in with patients right off the bat. Zach, I'll have you come up, buddy. So going back to this chart, liver, gallbladder, upper right side, stomach in the center, pancreas on the left. We just talked about all this. So in our muscle testing patients, heart, see if someone's testable, negative, positive. Dr. Tent's old lectures, apple, strong, cigarette in the hand, weak. Going through these reflexes and just checking the upper stomach. I could have 5 stomach aches, and I might be treating all 5 of them different just based on the simple muscle testing. If I'm going to check a hiatal hernia, I'm going to do the triangle muscle check right there. If the hiatal hernia is weak, it's going to be an issue right there. If it's a stomach ulcer, finger right in the stomach, weak. Pancreas is on your upper left. We're going to check that. The gallbladder is on the upper right. We're going to check that. Sometimes we'll poke just on all 3 spots, and just on tenderness alone, you're going to let us know what's bothering you the most. Some of these symptoms from each organ can kind of mirror image each other. With some of the nausea from an ulcer could mirror image a little bit of that pancreas issue. Some of the stuff from the gallbladder could create some nausea with that, but the muscle testing is going to help guide us, and we grabbing certain nutrients and checking it over the stomach, whether it's the beta TCP, whether it's the AF beta food, grabbing the Argodex and going after the pancreas, whether it's the gastrizyme and we're checking the stomach. Muscle testing is going to help us start in knowing how to treat a lot of these patients. Thanks for coming up, man. So on top of the dirty dozen food list, you need to start worrying now more about all the GMO foods that we're being exposed to. Kind of going back in review, what is a GMO? A GMO is an organically modified organism. It's a plant, an animal, microorganism, or other organism whose genetic makeup has been modified in a laboratory using genetic engineering or transgenic technology. This creates combinations of plant, animal, bacteria, virus, genes that do not occur in nature or through traditional crossbreeding methods. I don't want to eat GMO foods. There's problems we're having with this. There's a reason why Europe and everywhere else, they don't want this stuff in their country. There's problems that we're having that people are slowly waking up to. Now, glyphosate's the herbicide, the active component that's in Roundup. It composes Roundup is 41% glyphosate. And there's problems just with that alone. EPA scientist warns that glyphosate Roundup herbicide strips minerals out of the food, leaving the body deficient in zinc and magnesium. So glyphosate has the ability to strip minerals from people. It kills your good microbe on your gut, and it creates gut inflammation. The scientist, Dr. Copley, who died from cancer, worked for the EPA for 3 decades until her illness made it impossible for her to continue. She wrote the letter to EPA colleague in Monsanto Ms. Rowland in 2013. 2 years before a public debate over the carcinogenic effect of glyphosate before glyphosate began. So yes, she was the one putting this out there that there's issues with glyphosate, and this stuff is in everything, unfortunately. These are just some of the things that she talked about, but she mentioned just how it strips minerals from the body and how she felt that it has carcinogenic effects. My heavy metal lecture was based off of Mike Adams' Food Forensics. He also talked about the GMO issue in his book. I love the term slow kill. Between heavy metals, the GMO food, glyphosate component, it's an absolute slow kill. The real danger to health comes from long-term exposure to low-level toxins over time. Get this out of your guys' way. Is an absolute slow kill. We are under a complete slow kill mechanism with this stuff. The man who fought Monsanto will leave a lasting legacy. This gentleman was awarded $289 million damages. This is Dwayne Lee Johnson. They had enough evidence to say that his exposure to using a glyphosate-based weed killer was a causing factor for his cancer. Ever since this came out, Monsanto faces a surge of lawsuits following the cancer ruling. So there are going to be more people going after this stuff because of that ruling. This is unbelievable, and it's an absolute, it's about time. When I talk about colon cancer, I'm going to get back to this. There's one thing if we're eating this stuff, and it's another thing if you're having vaccines that are contaminated with glyphosate and it's being injected directly into your bloodstream. This is the work from scientist Anthony Samsel and as well as Stephanie Seneff, and showing their work in certain vaccines that have contaminated amounts of glyphosate within it. You can find and follow up with the link down below. You can't detoxify things out of your system sometimes if they're injected directly into you. And I did a lecture in the past from Dr. Russell Blaylock and talking about excitotoxic components, and glyphosate exhibits, I feel, like MSG. He talked about his work with MSG and aspartame, how it has excitotoxic components which will create brain inflammation, and this brain inflammation breaks down areas in the brain, which is seen in a lot of common neurological conditions listed above. And I highly believe glyphosate is another causing agent that has excitotoxic components that we're seeing in some of these children with some of these challenging health conditions. Scientist Stephanie Seneff, and she's got great literature looking at some of these things with the GMO food component. You know, they've got a correlation thinking that the higher rates of autism have been a component to this glyphosate component. I kind of came back last month, you know, rewatching a little bit of the VAX film, Dr. Andrew Wakefield dealing with allegations. Hearing him talk and hearing him address the story, this poor gentleman, scientist, was just thrown under the bus, lost his career, his country. Just, you know, unbelievable just how they just threw this gentleman under the bus. My heart goes out to him because he was just looking for answers for these autistic children, and his work showed that maybe there's a his work showed there's a possible correlation with the MMR vaccine in some of these autistic children today. He's a GI doctor, and the reason I talk about him within this lecture is he said, you know, it's not normal for these kids to have such inflamed guts today. You find it unusual that all these children today seem to have high problems to dairy, everyone seems to be gluten intolerant, and everyone seems to have all this gut inflammation. It's problems in the food that we're eating, and man, I can't emphasize the foreign patients that come in our office. What's in your American food? Because my stomach hurts all the time. Something's in your food because I go home, eat whatever I want, and I have no problems. I have no problems. I had American patients, I'm gluten-free. I have gluten issues in the United States. I traveled to Italy, traveled to Europe. I have no problems. I could eat whatever. I'm eating breads and everything there and not having any issues. I got a lovely patient that I was debating if I'm going to tell her story a little bit, but you know, I love her story. Miss Doris in the front over here. Just talking about, you guys have things such, you know, you're backwards in the United States. Where I'm from, we're sick. We go to our vitamins, we go to our herbs, our minerals, our homeopathics. We work from a conservative standpoint. Yes, medicine's there if we need things. It's the worst case scenario, but we work from a conservative standpoint before we get there. In your country, you guys get completely beat up with your medications and your surgeries and everything before you search out different alternatives. If you live in Michigan, they're having a vaccine choice symposium. Dr. Brownstein, Dr. Bogner, and Dr. Neuenschwander will be talking at this. They had one last year. They wanted Dr. Tent and I to be there or talk at that one too, but we had a continuing education thing with the chiropractic stuff, so we did not make that. We may show up to this to show some support. Tent and I are kind of burnt talking about vaccine stuff. You know how we feel if you've watched enough of our lectures, and that'll be October 25th. Small bowel health. So let's travel a little bit further down the GI tract. Dr. Axe has some good stuff. I'll give him credit where credit is due. Looking at now, leaky gut, a lot of your absorption of minerals and things, you know, and nutrients begins, you know, a lot of minerals in the stomach, but a lot of the other absorption in the first part of your small intestine. So you have tight junctions in the small intestine that nothing should cross through. Damaged guts, pathogens, toxins, microorganisms, gluten, other components will leak into that, get in your bloodstream, create immune reactions, which will further lead to nutrient malabsorption, autoimmune issues, food intolerance, brain-blood barrier problems, and inflammation. And the gut inflammation kind of stems a good bit from that. So I liked his analysis with this. Leaky gut, in simple terms, is intestinal hypermobility. Too many things are crossing the intestinal barrier. So you hear a lot of this, but what are the actual symptoms of leaky gut? Food sensitivities, nutrient malabsorption, inflammation, skin conditions, mood issues, ulcers, bowel problems, the IBS, IBD, SIBO, celiac. We'll be talking about some of that as well. Cancers, allergies, respiratory issues. You know, a lot of those things are components of compromised leaky gut issues. So, what creates these holes? What damages the intestinal lining with these patients? The standard American diet, too many sugars, which is the standard American diet. Your food sensitivities, gluten, dairy, grain, sugar, genetically modified foods, absolutely. Glyphosate should be right under that as well. Soda, alcohol, NSAIDs. I'd say NSAIDs and antibiotics are some of the two biggest ones that I'm seeing that will create a lot of these issues with guts today. Chemotherapy, stress, heavy metal components, and other toxins are culprits that will drive people into having leaky gut type problems. So there's different ways that you could test this. Some of the functional medicine stuff and some of the basic things is just your sensitive 7. You look at your sensitive 7, if someone's lights the whole panel up a little bit like this, this tells me they got leaky gut issues, they don't have enough good stomach acid to help properly digest the proteins, and this is, you know, what a classic leaky gut patient will look like just with the sensitive 7 testing. I've got a more expanded food panel on that I could run through Genova, which checks like 100, 200 different foods, but looking at your main 7, your main inflammatory 7 is where I love to start with a lot of patients with this. That at the office runs about 90 bucks. If you want to run the Candida factor, that runs another extra 50 bucks with LabCorp. Genova also has some cool testing, the intestinal permeability assessment. I haven't ran too many of these, but upon request, I could run one of these with patients as we're working with rebuilding the gut with certain patients. I like to kind of follow the 5R system when dealing with leaky gut patients, and that's 1, remove, 2, replace, 3, reinoculate, 4, repair, and 5, kind of rebalance the gut. And when you say remove, you're removing food allergens, infections, stress, NSAIDs, antibiotics, inflammation. You got to remove the component that's destroying parts of the gut and problems. 2, replace the enzymes, replace the acid. Going back to that panel, the sensitive 7, that patient needs more enzymes, they need more acid to digest those things, and those higher food sensitivities, they need to remove that from the gut. Probiotics, the third thing as far as reinoculate. You know, you're rebuilding the gut, you're strengthening it, you need the probiotics. And the repair component with 4, the L-glutamine, the probiotics, decreasing the inflammation, using like vitamin A, chlorophyll, things to kind of help heal the gut is the repair component. And then rebalance, you know, addressing sleep issues and stress components so these things don't come back. Irritable bowel disease. So with irritable bowel disease, it pretty much classifies Crohn's and ulcerative colitis depending on where your body's attacking the gut at. Crohn's typically will affect anywhere. It could affect the large colon, it could affect the small colon, it could affect both of them. Ulcerative colitis will typically affect only the large colon. The 15, you know, the foods affecting us, the amount of more young people I'm seeing with this colitis stuff and pooping blood is scary. To say that goes beyond genetic, this crap we're eating that's destroying our guts and pushing people into this colitis stuff today. And these cases could be very, very tricky. Tent and I will not hesitate to refer them out if they're not getting better, because between multiple bowel movements of blood, dehydration and anemia become a big time problem. In some of these cases, we need to kind of coincide and work with medication to get them stabilized, because these could be very challenging. This girl, 15 years old, had diagnosed with Crohn's disease 4 years ago. First symptom was lower abdominal pain with blood in the stool. Started taking Remicade in 2015. After a scope was done, diagnosed with Crohn's. Current symptoms: goes 2 to 3 days without having a bowel movement. Some stomach pain, blood in the stool when she does have a bowel movement. I treated her for gallbladder issues, and I treated her for parasite issues, and she hasn't had one attack since. She's been absolutely great. Parasites and gallbladder issues, everything was gone. I ran her food sensitivities, her higher ones I cut out, keep the gut inflammation down. She's doing great. It's cool stuff. It's a great case that turned around. A little bit more of a challenging case. This 12-year-old ulcerative colitis patient, blood in the stool, diagnosed with ulcerative colitis, which turned into pancreatitis, which is ulcerative colitis that infects the whole entire large colon. Every time she comes off steroids, she gets blood in the stool, so she's having a hard time not living on steroids. I had to kind of meet in the middle with her between doing gastroside chlorophyll. I coated her bowels, and she was also using curcumin. As long as she keeps up on her chlorophyll and her curcumin, she doesn't get blood in her stools, and she can manage it without having to live on steroids, and it's nice. And I got ways of measuring some of this gut inflammation. One of the things that I will use with patients if they're having a lot of issues as far as their gut and these tricky Crohn's, colitis, any colitis in general with a lot of blood in their stool, I'll push them doing more of a GAPS-based diet. And in the beginning phase of this GAPS diet, it's using heavy amount of just drinking broth throughout the day. This works phenomenal. I cannot give someone steroids if someone's gut's acting up that bad and they got to get referred to the hospital. They're going to put them on IVs, and they're going to put them on antibiotics, steroids, and not eating anything. The closest I could get to that is putting them on a GAPS diet and using some of my other stuff to get the inflammation down on the gut before they have to get referred out. Some of my Genova testing, this is a stool analysis, I will see the gut, that I got 3 main gut inflammation markers. This helps me differentiate if someone's dealing with irritable bowel disease, or if this is just a simple IBS case, depending on the amount of gut inflammation that they have on this panel. I love this panel. It tells me a lot. If you got a tricky gut, I'm not going to hesitate to run this panel if you want to get your gut under control. If you got that gut inflammation, the one and only Metagenics product we carry at the office is Ultra Inflamex. I've got people on this, children and teenagers on this, that manage their colitis symptoms without having to go on Remicade, without having to do steroids, by doing this one product. The stool analysis I was talking about is the Genova 3-day stool analysis. We run this at the office. It's $171, and then they use your insurance. I love this test. It tells me a lot when I'm dealing with these challenging cases. Looking and kind of combing through one a little bit, it's going to show me infection factors. It's going to look at your inflammation markers. If you have insufficient enzymes breaking things down, it's going to show me those insufficiencies. There's an imbalance between the fungal, yeast, bacterial issues. It's going to show me that. It's going to show me where you should be at if you're lacking good probiotic as far as your good microbe on your gut. Very, very informative. This is a Crohn's patient. This guy had suicidal tendencies. He was skinnier than anything, could hardly keep weight on. Digesting his fats. All his fats were going through him. He had a gallbladder issue. He's not digesting his fats. All his fats are high in his stool. your brain's 60% fat, starve your brain of fats, and his moods went downhill with this. Not only that, the majority of your serotonin is produced in your stomach and your gut, so if you got a sick gut, you're not going to produce serotonin like you should, and that's going to affect your moods as well. So a lot of people want to play their moods and have these mood issues. You must look at the gut a lot of times with this as well. You cannot ignore that. Down below, the inflammation markers and then digesting carbohydrates in that, down below. This also shows me if people have SIBO, small intestinal bacterial overgrowth issues. This is a marker. This is, good bacteria on the gut that has overgrown. And it'll also show me factors like the Candida stuff, which I'll talk about as well. It will go through parasites, and it'll look at parasites on this. Now, yesterday was a full moon, so some of these parasitic symptoms may flare up around a full moon. These lower stomach aches, which I'll talk about later in the lecture with the parasite stuff, is not uncommon around the full moon. So what is SIBO? SIBO is small intestinal bacterial overgrowth. Occurs when bacteria in your small intestine get out of balance and overgrowth. It's your own good bacteria in your gut that kind of overgrows. And some of the byproducts of these things creates off gases. So it's typically diagnosed with like a breath test, a stool analysis, or an organic acids test. Helps me determine if you have a SIBO issue. These are symptoms of SIBO: nausea, bloating, vomiting, diarrhea, malnutrition, weight loss, joint pain, fatigue, rashes, acne, eczema, asthma, depression, rosacea. All very common symptoms of SIBO component. One of my first cases I ever had in, gentleman just had crazy amount of gas, eating and not eating, just crazy amount of gas. He couldn't figure out what was going on. And it was a stool analysis that helped me determine it was a SIBO component. 60–70% of it was the Candida factor. I fixed the Candida on him, and it was the SIBO that was the last of it. I love berberine. Berberine is one of those things that will go after this component of intestinal bacterial overgrowth issues. This has been probably my personal favorite product, just even for myself. My lipid numbers, if you watch my male lecture, I've showed you how crappy my lipid numbers genetically are between cholesterol and even triglycerides. This has brought down my triglycerides to finally normal range. I wasn't even working on my A1C. It brought my A1C down from 5.5 to 5.0. I do 2 twice a day with glucose sugar balance just to work with my insulin resistant components. I love it. I don't miss that. These are the other benefits, health benefits of berberine. Reduces the triglycerides, reduces the fat in the liver, improves the blood sugar. This is like natural metformin. If I'm trying to get patients off metformin, I'm going to berberine. This works phenomenal. You get people on the right diet, cut out the sugars and carbohydrates, berberine, bang, this works great. Going back to the intestinal bacterial overgrowth issues, on the stool analysis, what's really nice about that is it shows me which antibiotics are resistant or sensitive to that specific pathogen. But down below where I'm more concerned, I want the nutraceuticals to go after this bacterial overgrowth issue, and you'll see berberine tends to be typically a bit higher with a lot of these components with these bacterial overgrowth issues. So it lets us know which nutraceutical is going to work best for this intestinal bacterial overgrowth issues with a lot of the patients. Now I'll go to the Candida issue. Go back to one panel. We normally run the Senso 7 with the Candida factor. You can see this Candida factor is around 41. And when it gets double digits, people will have these issues with this Candida component. The stool analysis will pick this up as well, and it'll let you know which nutraceuticals between caprylic acid, berberine, garlic, and all that will work a bit better for that. There's reasons why people get these recurrent infections, this recurrent yeast issue in the body. Long-term use of antibiotics, too many steroids, hepatitis B vaccines, hormone replacement therapy, birth control, adrenal issues, too many sugars in the diet, and these infections linger forever, and they get the recurrent vaginal yeast infection, the itching in the ears, the rashes, the eczema type stuff. the coated white tongue. This is all the reason people continue to get this. If you have that insulin resistant issue, if you have the high blood sugar, your blood sugar is elevated, it continually feeds into this Candida issue, and people have a hard time getting over this infection if their blood sugar is chronically running high with this as well. 80% of your immunity is through your gut. I've said that a few times tonight. I don't want to talk too much about probiotics. I was going to talk a bit about them, but I'm not going to say too much. Yes, doing probiotics is going to help strengthen your gut. It's going to help repair your gut and strengthen your gut. If you have more chronic bowel issues, I'm going to keep people consistently on a probiotic. If you're generally pretty healthy, maybe 1 to 2 rounds a year is all I'm going to do with most people. Knowing what's killing your good germ on your gut is very important though. Overuse of the antibiotics, the sugars, the GMO foods, inflammatory, gluten and food sensitivity issues, the emotional stress, medications, you know, your antibiotics, steroids, NSAID stuff, alcohol, lack of exercise, over-sanitation, smoking, poor habits. You know, all these things will have a contributing factor destroying the germ, and every infection that people go to, every cough, sniffle, and sneeze, going to these urgent cares today, they're giving people Z-Pack after Z-Pack after Z-Pack, and it's just destroying people in their guts very easily. The stool analysis shows me your good germ on your gut, so if I need to do something a little bit more custom for your gut, we can find out which strain of bacteria you're lacking and work with Clear Labs and find more of a custom probiotic for you. If you're low on most of them, my Clear Labs Probiotic Complete covers all the germs. That's one of my go-to ones for my more challenging guts. Going to the large intestine, constipation stuff. You know, if people are constipated, everything starts north. You digest things in your stomach. If things are not digested well, they'll go south: gas, bloating, indigestion, constipation issues. Patients need more stomach acid. They need more bile secretion from their gallbladder to help digest things. That bile from your gallbladder has a laxative effect to keep your bowels moving. Most of the constipation is going to be stomach and liver gallbladder issues. If it's a food sensitivity issue, it's going to be problems with gluten, dairy, which I'm going to run on my food factors. And you know, these are some of the other contributing factors as well that will contribute to the constipation. Now, there's a difference between having celiac issues and gluten intolerance. The vast majority of people, when I'm checking this stuff, will be more gluten intolerant. Celiac is more of an autoimmune reaction to gluten. The gluten intolerance people have certain reactions with, but it's not autoimmune in nature. How do I determine, you know, the differences between this and what people are actually dealing with? Genova's got a real nice panel that I'll run. I had a gentleman, this kid was about 14, 15 years old, getting chronic cold sore issues. We found out through the sensitive 7 the IgG factor gluten was elevated. If that's up, most of these people tend to be gluten intolerant. She wanted to check celiac with him. I was not concerned he was celiac sensitive, but I ran my Genova panel to, you know, show her that it's not a celiac issue. They will try to really push people in the biopsy. Their chart's really nice with Genova of which marker is negative or positive to see if they need to be referred for a biopsy. But most of the time, the IgG thing will tell me. Your symptoms will tell us as well. You hop off the stuff and go back on it, you'll know how good you feel with it. I hate putting people on certain diets. If I don't feel that they need it, I'm not the one to push everyone into a gluten-free diet unless I feel it's going to benefit them. So this is colon cancers. Many different stages of colon cancer. Stage 0, 1 to 2, all that is all within the colon. Stage 3, the cancer goes to the lymph node. Stage 4, it spreads to the lung or liver. Symptoms may be blood in the stool, change in bowel habits, constipation, narrow stools, excessive amounts of gas. African Americans typically tend to have the highest amount of colon cancer. This is from cancer.net as well. So looking at some of the facts on this, there's a decrease of colon cancer in 50 and above, but there's an increase of colorectal cancer in 50 and younger. So the younger people are getting more of this. Colon cancer in men, the average diagnosis is around age 68. In women, it's about 72. I'm seeing a scarier trend of younger people, late 30s, early 40s, diagnosed with colorectal cancer in the office. This really makes me question what is in our food creating this stuff, because the average diagnosis of this stuff, 68, 72, now we're seeing people, late 30s, early 40s being diagnosed with this stuff. And I had a patient that just got through treatment. She, I ran blood work on her in April. Her blood work looked like a complete A+. She had 0 symptoms of anything. That fall, she went to the hospital because she couldn't move her bowels. Her bowels were blocked up. And when they went in to go see why it was blocked, it was a tumor blocking her colon. They found out she had a stage 4 colon cancer, and her blood work looked phenomenal. I was stunned by this, absolutely stunned. But more stunned that the just amount of younger and younger cases in the office coming in is just unbelievable, which makes me question these wonderful GMO foods today. This was an 85-year-old lady. I talked about this about a lecture or two ago. This was great. She had colon cancer. They moved the foot of her colon out. 30 lymph nodes were all confirmed cancerous. She did 2 weeks of chemo. She's like, I can't tolerate it. I feel worse. I'm not going to do it. So I'm here to see you and just give me nutritional support. I'm 85 years old. If I live, I live. If I don't, I don't. It's pretty much what she was telling me. I put her on a pretty cool, I put her on a 90% plant-based diet, 10% meat. That 10% meat was chicken, fish, turkey. I did the GCMF protocol with her. And she said, her husband's like, she's got more energy than she has had since her early 40s. I don't know what you've done with my wife, but you've given me a new wife. They went down to the MD Anderson clinic down in Houston because their children live down there. Like, well, we're just going to get a follow-up with them just to see, what their take is on it as well. And he called me back. He's like, they can't find cancer in her. They can't find any cancer in her. We know there was cancer. There was 30 lymph nodes confirmed. They cut out a section of her bowel. They can't find any cancer in her. He was completely stunned. It was just an absolute cool case. Probably one of the coolest home runs in the last year was this case. 85 years old. Why give up, right? 85 years old. You get people on the right diet, the right supplements. It's amazing what you could change. She was doing great. That was after just early last year, January. Biofilm. This is very important to talk about. Biofilms are the mucus film that forms protective layers over bacteria and fungi colonies. They are common in nature. The film covering rocks in a river, the film covering the back of your teeth are examples. Biofilm could either promote health or illness depending on the bacterial makeup and the size of the biofilm. More of these infections today are becoming more challenging because of this biofilm issue and this antibiotic resistant superbug infection stuff that we're dealing with. So this biofilm, little bacteria collect in one area, they get together, build a protective barrier around them. Antibiotics and medications kind of bounce off this biofilm and don't get to the pathogen. It gets big enough and they will split out. The problem is trying to use nutritional supplements and enzymes to help break down that biofilm to get at the pathogen. I'm going more aggressively at a lot of these infections today that we're struggling with today by going after the biofilm component. I'm working with Dr. Thiel of Food Research. I'm taking the 2 best products right now that I think that are on the market between Interphase Plus and Biocidin. I'm taking those 2 formulas and putting them together, and we're creating a biofilm breaker through food research that will hopefully be out in the next few months. It's very cool. I'm really excited about it. Another reason that I like berberine is that it has protective barriers with some of these biofilm components with MRSA today. My gosh, you go to the hospital today, look out. Got to look out. You got higher amounts of septic infections. All this hospital-induced infection stuff is unbelievable today. Now, last night was a full moon. Let's talk about some fun parasite stuff. Pale complexion, dark rings around the eyes, crabby, irritable, fatigue, stomach and gut pains, itching in the butt, grinding of the teeth in children. These are symptoms of parasites in individuals. Very prevalent. What most Western doctors don't recognize parasites in our country. You go to Mexico, you go to Europe, they deworm children all the time. In the United States, we deworm cats and dogs, but we don't do anything for our children. This was a 3-year-old about 5 months ago. Asymptomatic girl woke up one morning, her mom's found a roundworm in her diaper. They live on a farm, 7 children, and that just appears asymptomatic. I got another lady I'm dealing with right now. We're, urgent bowel movements, chronic loose bowel movements. On her blood work, she tested high for Giardia. We're trying to figure out where it came from. Normally, Giardia is contaminated water, and we're thinking her well was the actual source. So we're going to check her well as we're going after her gut with this. I've got a dog trainer. It's kind of my funniest story with the parasite lately. And she trains these dogs. She's on ESPN and all that, going through all the hoops and that kind of stuff. She was watching a litter of dogs, contracted some parasite from those dogs, started getting these crazy loose bowel movements. She was pooping and peeing some blood with this. She came in, she goes, "What do you think this is?" I'm like, knowing you, you with the dogs and all that kind of stuff, I guarantee you, whatever the dogs you're with, you got something on your gut from these dogs. She checked that litter. She found out what parasite that they had. She took the medications the dogs were supposed to take for her gut. She got 80% better. They had no human form of this medication for this specific parasite, but she said, the dogs take it, pigs, horses, and other mammals take it. Why can't I take it? So she blindly started taking this medication. Her gut was 80% better going after this parasite stuff. Your pet animal's a pretty common factor for some of these parasites with people. I had one gentleman in the office coming to me one day. He goes, "I think I got the same thing the dogs got." I go, "What are you talking about?" He's like, "Well, one day I was walking around the corner and I'm itching my butt, and I see the dog walking, dragging his butt across the carpet. I'm looking at him, looking at me. He's like, I think we may have the same thing going on." I'm not impressed with stool analysis catching the parasites. Sometimes these parasites are higher up, and they won't always necessarily show in the stool analysis. The muscle testing, the symptoms, the full moon stuff, for sure the muscle testing is where I'm going to look at as far as that parasitic stuff goes. A lot of stuff's proteolytic enzymes. Whether you have them or not, clean up your GI tract. It's very easy working with them. So where do I start? CRA, the contact reflex analysis, the muscle testing, as I was showing you kind of how we go through certain areas of the stomach. The muscle testing shows us a lot of things. If the stomachs aren't turning a corner, I'm going to run food sensitivities. I want to run that sensitive 7-panel, $90. It lets me know if you need to cut some things out, or if, is this a temporary thing or whatever. A hair analysis, if you had one done, not only the heavy metals are great to check with that, but it's going to show if you're picking up your minerals, if you have low stomach acid issues. Very, very helpful. If you've got killed with the antibiotics and the steroids over the years, and you want to look at your Candida factor, look at that Candida factor with that. If your gut's very challenging, or struggling, or hitting walls and hitting that plateau, I'm going to dig deeper with my testing. I'm going to run that 3-day stool analysis testing with you. Health insurance has as much to do with being healthy as life insurance has to do with being alive. If you rely on your insurance company's recommendations for a plan for your health care needs, we hope you have good life insurance. You are what you invest in your health. I can't emphasize that enough. You are what you invest in your health. I put a lot in my health with the supplements because I treat a lot of mess in the office, and I don't take my health for granted. And when I worked at the hospital was my beginning the journey. I was like, my gosh, a lot of this stuff is preventable. A lot of people think, oh, it's just genetic. It was only my time, my parents had issues, and this is genetic. And I can't stress to you, your lifestyle controls your genes. Your lifestyle can turn on and turn off certain genes. Your genes aren't your destiny. Your lifestyle is. We use standard process food research, biotics research in the office. We could customize something specific for you. Our online ordering, 175 and above, free shipping. I'm still doing A-lines. My lecture list is growing. And that is the end.